I confirm. I confirm. Please proceed.
Okay, great. So, as you all know, in our February meeting, some of the things that we agreed was members requested that we focus on some topical areas that were of key concern to members. The last webinar we had was on cybersecurity, where we were able to highlight the challenges in cybersecurity and specifically in areas relating to health. So today, I can see that we have our CEO, that is Dr. Tim Theory. You can just unmute and say hi.
Morning, everyone. Thank you, Kanda. And I'm looking forward to a fantastic session on the guidance from the ODPC. Thank you. Karibuni, everyone.
Thank you, Tim. And then I'll have Jean, who's the co-chair of the committee, to say hi before I welcome our guest speaker. Jean?
Morning. Morning, everyone. Sorry, I'm in transit. Thanks, Kanda. Good to see everyone here and really looking forward to the session.
Great. Thanks, Jean. You can see that we are now approaching almost 60 participants. I think that's good quorum for us to start. So I'll quickly introduce our speaker of the day. That's Victory Loch. So Victory Loch is a risk and compliance, legal and data protection officer. And her background, she holds a Bachelor's of Law from the University of Nairobi. She also holds a Bachelor of Commerce from Masinde Muliro University. She also has a certificate in data protection from Strathmore University. She's also undergoing current certifications in CIPP and CIPM training by the International Association of Privacy Professionals. She also has a postgraduate diploma from the Kenya School of Law. So she's an advocate of the High Court. And currently she works as the data protection officer at Getus Children's Hospital. She brings in a unique blend of legal and financial expertise to her role based on the qualification that I highlighted. And she's experienced in risk and compliance. And today she'll be taking us through the Data Protection Act and specifically the Health Guidance Note that was issued by the ODPC. As you all know, this was issued in January. And it's just for the sake that members are able to understand also the terms and the definitions that as specified by the ODPC. So with that said, Victory, the floor is yours. You can take it away.
Hello, morning.
Morning.
Confirm you can hear me and confirm the screen.
Yes, we can hear you loud and clear. You can proceed and share your screen. Martin, you can assist.
Okay. Thank you for the introduction, Peter. My name is Victory Lodge once again. I'm a data protection officer for the legal officer, data protection officer, and risk and compliance officer at Gertrude's. I'm very glad that you invited me to this training. And because of the amount of work that needs to be done, I'll go straight away into this and start with the background by saying there are very many data protection laws in Kenya other than just the Data Protection Act. We have the general regulations and we have quite a number of other regulations. And data protection for healthcare is just not restricted to the Data Protection Act. If you look at other laws such as the HIV/AIDS Prevention and Control Act, that is the HAPCA. If you look at the new laws that were introduced, that is the Digital Health Act, you'll find that each of those laws have a component of confidentiality and a component of data protection. And even before we had the Data Protection Act, the health industry is known to have a lot of confidentiality and just some level of data protection outside the Data Protection Act itself that now came and brought everyone into the field. So these guidelines were not issued without a background. These guidelines were issued specifically for health data. And the background is that we have the Act, as I mentioned, we have the regulations, and there was a wave in other countries. If you look at the US, you have HIPAA. If you look at the European Union, you have the GDPR. And if you look at specific countries, you'll have laws that specifically require confidentiality and a high level of data protection for not only the healthcare industry, but everyone in general. And before I go into the guidelines in particular, also to mention that these are not the only guidelines that are applicable to you or to us. So just because we're going through the guidelines on health data, you have to remember that as a player in the sector, you're also an employer. So you have to look at HR data. You're not only looking at health data. Some of you maybe have schools, and you have to look at data protection from the education sector. You have to consider this from a wide perspective. So just because we go through the ODPC guidelines on health data, don't restrict yourself to those guidelines. Also see very many other guidelines that have been issued, and they're still applicable to you. It's not only the health data that are applicable. So I've mentioned ODPC has several guidelines. They have guidelines on consent, guidelines on how you need to register. They have guidelines on doing data protection impact assessments. And then there's this one that was issued on the processing of health data. What I'll do today is we'll go through what I think are unique to the guidelines, because if you look at the guidelines, they break down what was already in the Act. They try to teach you that, they try to explain, for instance, in the health sector, how do we apply the principles? The data protection principles are applicable across board. If you go to the GDPR, it is the same principles. If you go to the Data Protection Act of Kenya, of Nigeria, there's one in South Africa, you'll find the principles mostly across with a few unique points here and there. So data, the ODPC guidelines explain how those principles can be applicable to you, and they give examples. And they also give a breakdown on the basis of processing, which is also another key point. And for our purposes, I think that it is easy to go through that and read them as an example. However, I thought that we should look at key compliance points that are brought in by the guidelines, and then see the tools of compliance and how in practice we can implement. How can we do this as a practical? The data protection guidelines have been at least compliance, and I want to go through a practical to give us what we can do. Also to mention at the beginning that I think these are important things that we should consider when you're applying the Data Protection Act. First is that data protection is a weak link game. I've seen some, because I work at a hospital, I have seen our neighbor, our good friends from within the hospital sector who have fallen prey to this regulation because a security officer did something, or someone at the front office did something. So if you've studied game theory, you know there are strong link games and there are weak link games. And weak link games, it is the small things that catch up with you. It is that front office lady who does not know her data protection obligations that is going to catch you. It's not going to be the person, it's not going to be a data protection officer who studied this from beginning to end. It's going to be that security officer or who does not know how to deal with data. So when you're putting this into practice, look at it from, you have to apply it from the grassroots level, you have to apply it from the bottom to the top and all the way around, and avoid any weaknesses in the system. 2, it is a principle-based law. There are laws that are based on the letter of the law. So you are told, do not kill. And it's straight as that. However, the data protection laws, the acts, the guidelines, and so forth, are a principle-based law. And the danger with the principle-based law is that you are judged not according to the letter of the law, you are judged according to the spirit of the law. And the spirit of the law in this instance is, if you look at those principles, you're told you should act in accordance with the principle of fairness. So you've written a contract with someone, you've done all these things, and then you're judged against fairness. You're told, oh, you are not fair. You see, from a legal perspective, fairness is such an ambiguous concept. How can we measure what is fair? So it is a very high standard. You're told act in accordance with the right of privacy. So how are you judging the right of privacy against your interests as a business, against your interests as a person, against what you in fact, someone might tell you they want this and that, but it is not in accordance with their right of privacy. If I send some cheeky photos somewhere, I'm acting against maybe my right of privacy. But is the other person now forced to act maybe against my wishes and impose upon me my right of privacy? I don't know if that is clear, but the point is this is a very strict law, because as opposed to letter-based law, principle-based laws are harder to abide by. 3, that the act itself defines data and differentiates personal data, which is the data of an identifiable person, blah, blah, blah. There's general data, there's your name, there's your age, and so forth. However, in the healthcare industry, you're mostly dealing with sensitive personal data, because health data is recognized as sensitive health data, and it's not the common. It does include the common things like diagnosis and so forth, but the likelihood is that almost every data you deal with, including say the age and so forth, because you're dealing with it in a healthcare context, is going to be judged as being health data. And if you've seen the penalties that have been given, for instance, persons who've published photos from a club, which is just not personal data, have had extremely punitive penalties. You get penalties in the millions, and that is for quote unquote ordinary data. So the fact that this is health data is considered a special category and of data that is sensitive, it is likely to attract higher fines. I saw an interview done by the ODPC herself, and she said that the health sector is one of the sectors that gives a headache, and I think part of it is because of the sensitivity of the data involved. For this, there's a high cost to compliance, and as we'll see, I'm not even sure we'll be able to, within the hour, look at the level of compliance needed to truly, if I were to go through an institution's data protection practices and assess it and come with the conclusion that this person has complied, I would think I'd have to see a certain level of workforce, I'd have to see a certain level of documentation. There's a very high, in my opinion, there's a relatively high cost to it, and especially if you're dealing with sensitive data. there is a very significant cost of compliance. It is also very punitive, and I've had the fortune or misfortune of testing out. This is a very high punitive law. Apart from, say, if someone reports you, apart from just the damages that are awarded to the person, you get people being issued with enforcement notices. There are administrative fines, and these administrative fines are limited to 1% of your turnover. So if you are wondering what the risk is for data protection, it is 1% of your revenues. So are you able to afford to lose 1% of your revenue? That is what the law has capped it at. And as long as data protection limits itself within that 1%, they can punish you within that range. So it's a very highly punitive law. Second to last, there's also a very high level of third-party risk that I think most people are blind to. Everyone, no company works as an island. You have to work with a number of distributors, you have to work with vendors, you have to work with people here and there. There's a very high level of third-party risk. In fact, I can almost be sure that everyone here is to some level non-compliant when it comes to their third-party risk. If you read the ODPC guidance, it states that the vendors that you work with, for instance, need to be registered with the data protection agency. They need to be registered data processors. They need to be registered data controllers. There needs to be a registration of data handlers. So who can tell me that for a fact, every single vendor that they have a registered data processor and a registered data controller? If I go through your books, I am sure I'll find at least half of them are not. And the reason why I know this is the ODPC has published a list of all the registered data processors and controllers, and that list is very small. It's like maybe 1,000 or so entities, at most 5,000 entities that are registered as data processor controllers. So are you going to refuse to work with people? And are you going to refuse to work with vendors? Or are you going to risk that vendor is going to cost you, a vendor bringing you business worth maybe 3 million shillings is going to cost you some 10 million shillings. So there's a very high level of third-party risk that you have to be aware of. And just having to force your third parties to be compliant because you're likely a data controller yourself, and you're going to be a data controller. I'm sure that in most instances you're a data controller, and a data controller is held accountable for the actions of the data processors who are the third parties. Lastly, it is the ease of prosecution when it comes to data protection. And I have also had the fortune or misfortune of testing this out. It takes less than 30 minutes to bring a data protection issue to the attention of the ODPC. I just need to log into the ODPC website, fill in a few details. It can take me even 5 minutes, and lodge that case. So if I'm being told that I only need to spend some 10 minutes and potentially gain 500,000 shillings from a healthcare provider, I mean, it only makes sense that many people will try to do the same. What you also need to do is set up governance structures. We need to look at how these principles are applied, because we say the Data Protection Act is a principle-based law. How do we manage processing of data? How do we look at the retention? How do we use data marketing? How do we communicate on our policies and our privacy notices? How do we manage the rights of data subjects? do we manage third parties? And how do we transfer health data? So when you're looking at the ODPC guidance, those are the main compliance points that you need to look at. Again, a key point by the guidance brought in by the guidance note is the tools that you need to apply for compliance. You need to undertake training. And the reason why I highlighted training as the first tool of compliance is because I mentioned that the data protection laws, including the guidelines, are a weak link then. It is not your perhaps head of HR or your middle level person that will cost you millions of shillings. It might be that the person that you do not training, maybe you did not train your front staff, maybe you did not train your catering staff, maybe you did not train your interns. Those are the that might cost you more. Every single person in the system matters, and therefore it is important to do training. I'm being told, please confirm you can hear better. I'm being informed that it's a bit choppy.
We can hear you. You can please proceed. It was slightly choppy, but we can still hear you loud and clear. Please proceed.
Yeah. Okay, my apologies. So I was highlighting some of the what I think are key issues that are brought about by the guidance note that you might not find in the regulations and the act, because the act and the regulations, in fact, the act will give you the general law. And then if you look at the regulations, it will break down and explain, for instance, how do we apply these principles? How do we apply this means of processing? The guidance note explains that, but the guidance note, over and above the explanation of the principles and the basis of processing and giving examples, is a practical tool of compliance. It tells you that for you to achieve full compliance, this is what we'll consider, and there's an entire checklist that reviews. There's an entire checklist for you to see whether or not you have fully complied. So I'm going through the main tools of compliance. Sorry. I'm going through the main tools of compliance, which are first training, and you need to train because this is a weak link game. Every single weakness in the system matters. Then there is vendor due diligence and compliance management, and I've highlighted that your third-party risk is likely going to be one of your most significant risks, because the guidelines state that you should ensure that the persons you're working with are compliant with the act. And because you're likely to be acting as a data controller and having separate data processors, that third-party risk is so high, you almost cannot, you're doomed either way. You cannot afford to work without third parties. And yet, every single error in terms of data protection that is done by your third parties on the data that you give them or their non-compliance is also likely to be reflected upon you. Three, you need to have I'll say a multidisciplinary approach. And I think a significant part of the multidisciplinary approach is having, I know most of our, I think most of this industry has IT is very IT dependent. I'm assuming that you're very high IT dependent organizations. And you have to have a multi-sector approach. You don't just get data protection from the quote unquote theoretical, from the legal, like you all these nice things are telling you have to comply and everything. Don't just look at it from the compliance perspective. You also have to look at it from the systems perspective. And the concept here is you have to design your systems so that it is privacy by default. It is not you asking someone to opt in into privacy. The system itself is set at default privacy. You're not, for instance, I'll give an example of security. You're not, for instance, giving everyone access to everything. You're controlling access so that by design, no one is given access, say, to X and Y zeros or X and Y Z data that is in the system, unless there's good reason they should be given. So having a very selective approach. Part of data protection is also having very high information security systems and having technical controls in place, because when your IT fails, as you're having a cyber incident or so forth, you're also by default having a data protection breach. And the highest level of data protection breach, usually the cases I've seen is due to laxity in IT or due to cybersecurity. Of course, we say that cybersecurity incidences are a matter of when and not if. And so you need to have a very multi-sector approach, get the advocates, get the lawyers to tell you how you need to comply, but the groundwork needs to be done by every single person, and the IT systems need to be in such a way that it is designed to default to privacy.
Loch, just 1
Yeah.
minute.
Yeah.
So for all the attendees, just as Jean has highlighted, there is a question and answer at the bottom of the screen, Q&A. You can type in all your questions there so that by the end of this session, I think Jean can lead us through the Q&A session. So, and then what I will ask Loch is on your side, if you're able to disable the video on your side, probably that might assist with with audio. So I think that's it. You can continue.
The video is disabled.
Oh, it's disabled already, so you can proceed. Thank you.
Perhaps could you maybe unplug your earphones or just use the speaker from the laptop?
Is this better?
Yes,
That's
perfect.
perfect.
Oh, okay. Remove the earphones.
Okay, thank you.
Okay. So again, tools of compliance. And this is again what is my interpretation of the guidance note. You need to have in place tools of compliance, and from a reading and a breakdown of the of how the ODPC has required someone to comply in processing health data. Now, this is not contained, this slide is not things that are contained in the guideline. This is a breakdown and interpretation of what you need to do to comply with the guideline and to comply when you're processing health data. So first, can you identify what your data protection obligations are? Map and do an inventory of your data. Get a record of your processing activities. If you're a data protection practitioner in there, you can just see the examples of record of processing activities that are done. This is highlighted in those of other countries, and it is a noted best practice tool. So you should have a record of processing activities. There's an entire guideline on how to do data protection, impact assessment or data processing impact assessments. You need to communicate, and I can't insist enough, you need to communicate both to your internal stakeholders through trainings, but also to your data subjects, where you're communicating your policies, you're putting them on your website. You need to issue your privacy notices. We issue some, and we issue them in hard copy, but you can also issue them in soft in practice, put them on your website, communicate. But as you're communicating, just know that you also like to be held to that communication. If you said we will not share your data with anyone in a privacy notice, and then you shared with someone, you'll be held to your notices you issued. Also, an interpretation of the guidance note, you need to have a governance program in place. So you need to have the privacy program, establish a framework and strategy on how you're going to approach data privacy. Also to note, I said there's high cost to compliance, and perhaps some of these might need you either decide to do it over time if you have a smaller team, or if you have a bigger team, then you can have all the structures in place. But at least you need to have some governance around data protection. Establish a program, establish a framework, establish a strategy. The Act does not mandate you to have a data protection officer. In fact, it says you may. So it's not a mandatory requirement. You can put it as inside the JD of someone doing some other work. You can have a different approach. There are certain organizations where you have an external data protection officer and they advise you. There are those that have committees, so that you have a multi-sector or a multidisciplinary approach. So put up a governance structure, have the persons responsible, select it from different sectors, or some people take it from IT, some people take it from data protection officers from customer experience, some take it from legal. So it just depends on your organization, but at least have a structure in place, and then have some level of leadership and examples from the top. Because again, if the middle level management and the other staff consider that this is not an issue that is taken seriously from the top, then they'll also follow a similar approach. Get your policies, your privacy notices and communication in place. Do some monitoring and an awareness through training. And I've highlighted some of the most, what I consider risky, but it will depend on your organization. I think customer experience can be a very risky area. Human resource can be a very risky area. IT, because of the technical organizational measures that the Act, the regulations, and the guideline requires them to have in place, is risky because they need to do so much in order for an organization to be compliant. If you're if you're dealing with clinical, or you're dealing now with patients directly, those people who particularly now deal with maybe patient data, or deal with, if you're insurance, you deal with actual people's data, actual health data, nurses, and so forth. Those are very risky. And then again, if you're handling finances, health data is just not what is strictly from the hospital. It's a broad range. So all these people, CX, HR, IT, will handle some level of health data. And if your customer experience is using health data to advertise, then you're going to the doghouse. So don't think of health data as being restricted to quote unquote strictly health. And then I'd say have some privacy champions, have a departmental level, have a breakdown of persons championing privacy from the top to the bottom. Have champions at every level. Do very high level of vendor management, and this is very tough in practice because sometimes you have to convince people to establish this whole system, and we've said that data protection can be a very costly matter, and you're trying to tell your vendor who's, I don't know, doing planning that they need to register as a data processor. Most of them will be like, no. So, but they're putting you at risk. So vendor management, have contracts in place, have your register of data processors and see the evidence of their being compliant and so forth. Then how do you manage data incidents? So I think that if you have all these governance structures in place, have all these tools of compliance in place, and you've assessed these key compliance points that we've mentioned and looked at these key issues, you're likely to be somewhere. For the final part and for a few minutes before we take answers and questions and comments, I looked at the guidance notes and you find a checklist. That checklist will help you assess whether you've complied with the guidelines. And the moment you've complied with the guidelines, because the ODPC has really broken it down for health data, you're most likely going to be compliant with all the others. So they've set like a marking scheme. It's going to be possible to go through all of them because this is a list of 32. It's like their examination booklet. And the moment you tick all those boxes, you find that you are likely to be compliant. The long and short of it is, if you look through them, you'll need to do a record of processing activities. A record of processing activities will help you assess whether you have established the proper basis. You'll need to do, first of all, a data map. Before you get to process, you do a data inventory, see what data do you have in place, do a data map, see the flow of data throughout your organization as it comes in. What are the collection points? How does it move throughout the organization? How are we processing it? And how does it go out? So who are the vendors that we are dealing with? So that record of processing activities, in my opinion, is perhaps one of the most important tools that you can have in place for data privacy management, along with then once you've had this record of processing activities, you have for the items that you consider to be maybe because of their nature, maybe because of the scope, you find that there's maybe heightened risk. Now you apply the data protection, the data processing impact assessments to see the level of risk and to see what tools you need to have in place. So you do the data map, you do an inventory, establish your policies. So for instance, they're asking, in the health sector, we process sensitive data and we've identified permitted grounds. So we've had our inventory, we've had our record processing activities and established permitted grounds. We've confirmed that all our processors are processing data within using the proper basis. We've notified our data subjects of how we are using their data, and we've put policies in place to manage this. Then it asks, do we restrict processing to where the legal basis applies? And this is also an issue with data lifecycle management, where we've done our mapping, we've established our basis on the proper means processing activities, we've issued privacy notices, and we've issued policies so that our stakeholders know how to use data. We've done proper vendor management, so we have contracts with our vendors and our suppliers, and we have measures. IT or every other department has put in place technical measures in order to technical and organizational measures to make sure that they are processing data with proper legal basis, and where they can minimize data, or they can pseudonymize or anonymize data, then they have done the same. And we have a schedule of data retention, and we've managed, or we've set up in place policies on data deletion or destruction, and therefore we're processing within proper legal basis. So just to ensure you're processing within proper legal basis, you need to do this whole list of things, in my opinion, for you to get to the highest level of compliance. Do we do anything that is generally unlawful? And again, I'll go back to the basic tool that I mentioned. Do you have data inventory? Do you have the proper policy in place? Do you have a record of your processing? Have you trained? So, and all these need to be documented. I think as an accountant, we say in all we trust, and all others must present evidence. So when the ODPC comes, they'll not only want to know that you're not doing anything unlawful, they need you to present evidence. So the evidence would be, we've done all these trainings, we've identified the reasons why we're processing, we know this is the data that we have, we've notified our users, and so forth. If you're subject to mandatory registration, have we registered? So this is again coming back to, I hope all of us have at the very least registered. That is Data Protection Act 101, you've registered. It is easier said than done on getting the vendors registered. So again, I'll say that one of the highest risks is third parties, and they're going to put you in trouble. You can have every single system in place, but if your vendors don't have their systems in place, you'll be implicated. It will be the Swahili saying, wapanya waliokuwa na wasiokuwa wote ndani. So when your vendors don't have their systems in place, you're implicated. We've considered the adverse effects on maybe individuals. So this is doing an impact assessment. Now that we've established that we have all our processing, in what processing we have, I'll give the example, we are in a children's hospital. So you see, apart from the fact that we're dealing with sensitive personal data, that is health data, we are also dealing with a sensitive category of data subject. So, and this would be part of your data mapping. In your data mapping, you'll identify the data subjects that you have. And if there are special categories of data subjects, such as children, then you need to apply an enhanced level of protection. So for data protection impact assessments, you need to look at the nature of the data you're dealing with, the nature of your data subjects, the scope of work that you're looking at, the purposes of why because if you're using data to treat someone, for instance, at the hospital, that will not require as much protection as if I'm using that same data for customer experience. If I just take my patient's data and need to treat them, that is a low level of privacy impact, because we are contrasting it with the purpose. But if I'm taking that same data and now using it for marketing, then I suddenly have to apply some enhanced level of protection and consideration. So do data protection impact assessments for the different processing. A common pitfall I see with data processing is people look at the data itself. How can I say this? Like, say we are collecting data, how we use it in HR versus how we use it in customer experience will be different, although it will be the same data. I find that people don't do data protection impact assessments per processing activity. It is not a data impact assessment, it is a processing impact assessment. It can be the same data, but the fact that you're processing it differently means that each of those processing activities will have different levels of risk. So don't do your data protection impact assessment per data subject. That might give you a distorted view. You might think that this category of data subject is so protected, or don't do it. You can do it, but like also consider that it is a processing impact assessment, and therefore the processing has to be the key consideration. We only handle data about individuals the way they reasonably expect. This is a communication issue. How are you ensuring that your data subjects have their rights in place? We don't allow discrimination and exploitation. That is also data subject rights management. And this can be in trouble. You can have all your data protection policies in place, everything set. But if you're not able to, give these data subjects their rights. There's a list of rights, and it is in the Act, it is in the regulations, it is replicated in the guidance notes. Data subjects have rights. They have, for instance, the right to ask that their data is deleted. There's a case I've handled where the data subject asked, please delete my data, because the right to erasure is the right to, data subject has right to erasure. So the data subject asks, please delete my data, and then the company, and this is a customer experience analyst, a representative, someone in the team just responds, oh, we need it for this and this and this. That simple response from a customer experience representative is costing this company close to 3.2 million shillings. So you have to have proper data subject right management system in place and know how to handle requests from your data subjects. If they ask to be erased, if you're insisting on keeping it, can you communicate and justify? If they're saying they don't need their data processed anymore, someone asked us not to process the data for data management, then we had to tell them, we have a basis because you've breached our contract. Our basis is we still need this for contract, but you have to lay it down for them. This is also in line with the principle of fairness. You have to be fair to your data subject. You have to have your privacy in default. It asks, we don't mislead people when you collect their personal data. So this is a communication issue. Have you communicated to your data subject why you're using their data and how you're using and who you're sending it to? I've seen very, very detailed data privacy notices where they even tell you, we will send your data to this vendor and this vendor and this vendor, and listing all the vendors. So as much as you can communicate, but don't set yourself a trap where you're communicating unrealistically. And this is why it is dangerous to set up privacy notices and policies without establishing first what is your practice, because it is easy to run to your website and give all these promises, oh, we will not share your data with anyone, and give all these promises. But if you've not done the preliminaries, you've not looked at the data map, you've not had an inventory, you've not looked at your processing activities, if you're doing your privacy notices uninformed, you're going to fall into the trap of setting up unrealistic expectations or writing a notice that differs from practice, and you'll be held accountable your policies, not just to the law. Identifying your purpose, I think this is which I've overly talked about. Again, I've talked about privacy notices so much. We review whether our processing is necessary for purposes. Again, that is compliance with your principles. So have you limited your purposes? If you collected it for health, don't use it for communication. If you collected it for communication, did you notify your data subject? Did you just take the minimum data necessary, because that is a principle for at the basic. This requires you to have a ROPA. If we plan to use personal data for a new purpose, we check that it is compatible. So again, this is where training comes in. Does your staff know the use of AROPA and the reasons we've established for processing data. And if that user then wants to go beyond that original limit, are they able to consult? And are we able to now establish new purposes? And if you use data for purpose that was, say, not in Europa, you're going to go beyond your purpose limit. You're going to go contrary to the purpose limitation principle. So again, that is Europa, but it is also a training and a principle application thing. Time is really running out. We use technical measures to limit the possibility of repurposing data. Technical measures, again, perhaps I'm limiting it to my background is in, I came from finance, industry, and consulting, and now I'm in health, which are, and all the companies I've worked for were very IT specific. Therefore, the technical measures I know that are most effective to be put in place are done by IT, and it involves IT and InfoSec. However, look at your systems. Even if it is not very IT dependent, there are technical and organizational measures that you can put in place so that, say, if we collected patient data in 2013, and now we've come to the point where we are no longer using it for the purposes that we collected it for, and say we want to use it for research. So how does IT help us? Maybe they anonymize, maybe they pseudonymize, maybe they mask this data so that it's, even when we are repurposing it, we are still be compliant with the right to privacy. Is IT or is your organization doing good data access management? Not everyone has access to every system. So that someone is not going to pick health data and using it to communicate without going through the proper channels. We have clarity on data retention. Why are we retaining this data? If you did proper data deletion and destruction, then reduce your risk of finding yourself repurposing data which you should have deleted either way. So if you don't have it, you'll not abuse it. Again, we go back to having a record of processing activities, because this will be your key reference point for processing activity. So you go back to Europa and say, what was the purpose that we initially established for processing this data, and why are we now going outside the scope of the purpose that we established? We collect personal data that is adequate, relevant. We can demonstrate the relevance of the data to the processing. Those are Europa issues. We review the data we hold. Again, this is on policies of data retention and IT measures or technical and organizational measures. We don't create copies. So if you do a proper data inventory, you can find that your maybe different departments are collecting this same data. HR is collecting data from staff. I'll give a non-health data example. Finance is also collecting data from staff. So if you do a data mapping exercise, you're able to consolidate your data collection points so that data is not haphazardly running through the organization and not being properly managed. You have a data inventory and you know who keeps which data and so forth. So clean up your data collection and distribution and access points in order to be compliant. Again, anonymization is on technical tools. There's a number of slides on technical tools that you can apply, but because of time, I don't think I'll go through them. Have proper technical tools in place. Do proper data management. Clean up. Have third-party agreements. Train employees to ensure accuracy. Automate processes. So these are just technical measures. These are a couple of slides on accuracy, which I'll share. We use technical and organizational measures. Again, this is about cleaning up your data, knowing how data goes through your organization, and establishing maps. Maybe I'll highlight this slide on policies. We have a policy on data retention. I'll highlight the issue of retention, destruction, and deletion of data. You have to be very careful that you're not maintaining data that is no longer required. So have a proper data retention schedule, have a proper data deletion and destruction schedule, and manage your vendors. I have had a common story along the health, in the health sector, where some public hospital somewhere, we won't mention them, their health records, like printed out papers and so forth. Someone went to a butcher and found the butcher covering meat with not gazettes, but now the health printouts from some such hospital. Or if you find someone wrapping jugus with papers printed from XYZ hospital, but you find insurance records being used by groundnut vendors. So it might be that you've established all the proper processes in place, but the person you've given your destruction vendor, because I'm sure we use a lot of them. You take your papers to maybe Chandaria, or you take your papers, I don't know which other place. But who is this person who is taking for you these papers there and are using it as a business opportunity? So be very careful of data retention, not just in-house, but also externally. Have the proper policies in place, have a schedule, and see how long are we retaining. And I think the problem with the health sector is we are likely to want to hold the data with good reason. Personally, I also want to retain data as long as possible, because I'm like, oh, we need continuity of care, and we need a background on all this data, but have a retention schedule so that even if you're deciding to hold this data forever, document the reason why you're holding this data indefinitely. Say, according to section this and this of this and this act, we are using it to justify where we are putting this data indefinitely. I've talked of data subject rights management and access requests by data subjects. This is a very litigious point. If you don't handle your data subjects well, you can easily land in trouble, even if everything that you have is in place. And I think this is among the last ones. Transfer of data, which happens very easily. As an example, as we are on Zoom, this is a transfer of data because we have, sure Zoom has its data centers or something, either in the cloud or in some country somewhere. And we are using Zoom to communicate. That technically is a transfer of data because we are taking it from Kenya and we're using, it's passing through even your emails. These people have data centers in different areas in the world. So I'll give an example. The French Data Protection Agency has a list of countries where they are okay with you passing your data through them. And the same is for Kenya. I think there are a number of countries where you're allowed to pass your data through, but document that emails, we are using Microsoft passes its data in data centers in countries that are known to comply with the Data Protection Act. You're most likely not going to be, I've not seen the ODPC punishing any I've not yet seen a decision on transfers. However, as people know more about data protection and as the litigation gets more complicated, I'm sure there is likely to be transfers. And the fact that the ODPC is allowed to audit you, they might come and look at your transfer practices. So the best reference I'd give you is go and look at the French Data Protection Agency and how they've given clarity on how to do transfers safely. So French Data Protection Agency is called CNIL. You can just look them up and they'll give you more practical guidance on transfer. I think all these again are covered. Part 4 of the Data Protection Act and regulations, that is on principles and processing. And I think this should be among the final ones. Always document, not only the purposes. I think this is the most clear basis I can use for justifying why I'm telling you to do a ROPA. The guidelines say we have documented these purposes. The purposes for which you're processing data are easiest documented in a ROPA. But for everything else, have these policies documented, have these privacy notices documented, have your police privacy program, your privacy framework documented, have your responses to data protection queries from data subjects documented. Document. If it's not documented, it didn't happen. If it's not documented, we are not trusting you on your word. And I thank you for the time and sorry for taking more time, for going over the time limit. That is all. I'll welcome questions and comments. And my name is Victory Lodge, Data Protection Officer at Gertrude Children's Hospital. That's all for now.
Thank you, Lodge. That was very elaborate. I think along the way, I just said, let's just indulge you because clearly the guidance note is quite comprehensive. And I think you've done a good job. Personally, I think that was a good job, well done job. There are some requests that have come in terms of, are you able to share the slides? I think we'll be able to facilitate that on the side through the secretariat and through Martin. Martin is our secretary to the committee. And I think at this point, Jean, you can be able to, I think, guide us through the Q&As.
Certainly. Thank you so much, Victory. Yeah, I think just from the numbers still on the call, we can see how important this topic is. We won't be able to go through all the questions because we want to be respectful of everyone's time. So we'll probably just pick 3. But as I mentioned, those that are not answered in this session, as we're sharing the recording, the presentation, we'll make sure that all these are covered. So the first one, I've answered it. The other 2, Victory did touch on that. So ensure the importance of evidence of compliance, have your contracts in place. So the element of vendor management is really critical, and Victory has emphasized that. I'll probably pick just these 3. So there's a question here. It's from an anonymous attendee. So when the DPA 2019 conflicts with the Digital Health Act 2023 on matters that are handling health data, which takes precedence? And I'll give an example. They've gone further. I don't know if it's the same person, but they said, for example, the DPA 2019 requires explicit consent from patients, and DHA 2023 indicates consent is not required when health services are being sought by the patients, which is the main reasons why patients go to hospital. So we can cover that one. Hi, Victory.
Thank you for the question. I think I'll look more into that question. I give the general answer as this. If there's a conflict between 2 laws, the general answer is the more specific law applies, and the more specific law applies, and the letter of the law applies. So the letter law will apply, or the more specific law will apply. Specifically for that conflict you're mentioning, there are identified at least 8 bases of processing, and laws are one of the bases of processing. Like consent is not the only basis of processing. You can process, if a law allows you to process, for instance, if you're sending tax data to KRA and the employee says, I don't consent to my data being sent to KRA, that won't work, because you tell them, I'm not relying on your consent, I'm relying on the law. So if there's a law that allows you to do something, then if the law says you don't need consent for this, you can use the legal basis. Again, just to comment on consent is a very terrible basis of processing, because if you look at the legal requirements on consent must be explicit, must be written, must be withdrawable, and so forth. If you're processing data and you can find any other basis other than consent, I'd say use that basis. If there's a legal basis, use that legal basis and note it down. Like, say, we are processing this patient's data because the Digital Health Act, because the Public Health Act, because the Health Act, or because maybe the Employment Act allows us. It is a recognized legal basis. And where there's a conflict between laws, it is always, not always, but it is mostly always held in favor of the person being accused. So if someone accuses you, or you did seek consent, and then you go and quote the Data Protection Act and say, the Data Protection Act allows me to use any of these 8 bases. I don't only have to rely on consent, I can rely on the law, I can rely on vital interest, I can rely on contract, I can rely on research as a basis. So to answer your specific question, if I had the option of using law over consent, I'll use law in that case. And then there's just the general permissiveness of, if there's a later law or if there's a more specific law, you can apply it. I don't know if that answers your question, but you can approach me nyuma ya tent, and then I'll explain it to you further.
Done in your agent. Thank you so much, Victor. I think that answers your question, Dr. Kingondu. So some guidelines may not apply to KRA. They will still get the data. Yes, Alan, we will share the link. I've also seen another request come through for the checklist, so we will take a note of all of this. Provided everyone was registered, then you will get it.
For your information, this checklist is on the guidelines.
Yes,
it's among the last pages. I've copy-pasted it from the guidelines and then just put comments on how I think it can be practically applied.
Thank you. Thank you. We'll reshare the guidelines to those who may not have them readily available. Thank you, Victory. So let me just take 2 more. We can finish at 8:45. What of the regulation for KMPDC that says we should keep medical data for 10 years? In this case, if a patient requests that you delete their data. So the issue of data deletion retention.
You can have so that's why you need to have a data retention schedule in place and data retention policies. And if you're deciding, in fact, I think for health data should be the Digital Health Act or something. There is a law that I think you can use to even keep the data longer than the 10 years. You just have to look at what data you have. That's why I said one of the first processes that you would have is doing a data map and have a data inventory. And then on that data inventory, look at the legal probable that you'd have. Put it there that KMPDC has said you keep this data for 10 years. The Digital Health Act has said you can keep this indefinitely. This Health Act says you keep it for this long. Compare those bases and then use the most appropriate basis to determine an appropriate timeline. So I'm not sure I can give every single person what is best practice for data retention schedule, because that would depend on your context. And again, because this is principle-based law, it is very context-specific. I can keep it indefinitely. And then if we consider your organization and the purposes, that advice goes against the purpose limitation principle, because just because you're allowed to keep it indefinitely does not mean that you keep it indefinitely. It might go against the right to privacy principle, it might go against the data minimization principle, it might go against the purpose limitation principle.
Thank you so much, Victory. We are still getting more questions, so what we can do is we'll take a list of all of these, and as we send out the recordings, we will make sure that each and every question is attended to. And if there's a request for follow-on session, we're very happy to have that as well. So thank you so much, Victory, for your time. This has been a very informative session, a lot of takeaways, and thank you. I did see someone had dropped takeaways in the chat for us as well. Kanda, your hand is up. I'll hand over to you to close out the meeting.
Okay. Oh yeah, thanks everyone for joining in today. Thanks Jean for leading us through that session. It was quite informative. I think Jean has already communicated in terms of the documents that will be shared. There is also an assessment tool, a free assessment tool that we also shared for those who want to just check their level of compliance. So I think that's one of the things that will be shared in the group. I think for those who are asking about how they are able to join the digital health committee, Martin will reach out to you and just give you updates. So thanks everyone. We had today, I think was a record. We had around 124, I think at one point, members log in. And we thank you for actively participating in our webinars. So hopefully to see you next month. We'll communicate what the next webinar will be. So enjoy the rest of your day, and thank you for joining me. Bye.
Thank you. Bye.